Hi, it's Alex from Integration Nation Bodywork and Integrative Bodywork for the Manual Therapist workshops. We've got a short technique video for you here presenting one of my favorite techniques, seated QL release. This technique gets the client off the table in gravity and presents a novel approach to working with the Quadratus Lumborum muscle and its associated fascia, while at the same time giving the client an opportunity for movement discovery and re-education as they have the ability to move and activate their QLs while the therapist is engaging the tissue. It also allows the therapist the opportunity to find restricted motions or fibers that they may not have found had the client been prone or side-lying. Before we start the technique, let's have a quick look at the QL itself. In this image here, we'd like you to notice that the QL can have up to 3 different fiber directions in it, 1 vertical and 2 separate diagonal fibers, one going from the lumbar transverse processes to the 12th rib, and the other from the iliac crest to the lumbar transverse processes. When there's a shift of the rib cage over the pelvis, like in this illustration, in this case the rib cage is shifted to the left of the pelvis, we have a dilemma for each QL. Notice how the fibers running diagonally from the bottom right to upper left of both QLs are elongated and the opposing diagonal fibers are shortened. When we look from this perspective, it is easy to see how the QL can be so problematic for our clients and that the solution is not always as simple as releasing just one QL. There may be some hidden fibers in the other QL that will want to pull the spine back into a restricted pattern even after the other QL has been released. With the seated QL work, I can get access to both QLs, I can work them simultaneously, and the client has the ability to move their spine back and forth, forward, backward, rotations, all kinds of different ways. So it's a really great technique for all of that. And I typically use it as a conclusion to sessions after we've released the erectors, released some of the side abdominals, and maybe even done some QL on the table to free this up so that it's not so much work for the hands getting in there and doing the work. I'm going to find my placement by going to the side of the erectors, which here are the erectors right there. Right at the edge of them, if I go up to the top, I'm going to see the 12th rib, which I got right there. As we go down, here's the iliac crest. PSIS is for reference point there. And I'm just going to sink in right at the edge of the erectors. And there's a little bit of a trough right in front of them, where you'll get kind of right near the transverse processes. And that's where the QL lives. How you doing, Melissa?
I'm wonderful, thank you.
Okay. So it definitely feels a little different from the two sides. The right feels cleaner to me. The left feels a little bit more restricted. How does that feel to you? What are you noticing?
The left definitely feels more restricted than the right.
Yeah. Okay. Well, let's work with this a little bit. Let me first have you bend to the left. When she bends to the left, the right hand gets pushed out, which is fine. The left hand, though, there's some slack in this tissue now, and I can follow that and get a little deeper, a little bit more insight into where this tissue is restricted most. Gonna sink into that. Now it's melting away a little bit. Let's have you move back to the right. Yes, good. So the opposite is now happening. My left hand gets pushed out. My right hand is able to sink in more, which I don't really need to sink in too much deeper. I really want to come back to that left-hand side. So come on back to neutral and let's just check where we're at. Yeah, that's good. Okay, definitely improvement, but there's still a little bit more. Let's try rotation. Could you have you turn your rib cage to the left? Good. This just adds a different layer, a different perspective on what the QL is doing with all this. Let me have you rotate back to the neutral and then to the right. Yeah, seems like the left is the more challenging direction, at least what I'm noticing. So go ahead and rotate back to the left. Excellent. I'm going to just give this a little bit more extra push. Yes, perfect. Now come on back to center. And the final thing I'd like to do is shifting your rib cage left and right. I'd like you to keep it level to the horizon, but move it to the left so that it's on top of your left hip. That's it exactly, perfect. This lets me get into these diagonal fibers of QL right here. Gives me a little more access to the upper right and the lower left. Yeah, there you go. That opened up really nicely. Awesome. Move back to the right. Let's see. Yeah, and just like with side bending and rotation, there's always going to be one favored side. One side that moves easier and one side that has more challenge to it. I want to go back to the left, so go ahead and shift back to the left. That seems to give me access to the spot right here that needs it. Good. Yeah, I like that. It's easing out nicely. Can you feel that?
Yes.
This change in there? Good. Okay, come on back to center. Excellent. Now I'm going to have you just take control of the movement. Slowly slide to the left, and then slowly, mindfully, with intention, shift back to the right. And we'll maybe do like 2 or 3 of these cycles. Good. Oh, that's changing really nicely. One more to the right. Okay, and come on back to the center. Good. Excellent breath in there. There's definitely better access to both sides. I can feel the fibers much more distinctly. Do you notice a difference in sensation now?
Yes, it feels much looser and it feels like your fingers are deeper in the tissue.
Yeah, definitely. Okay. All right. Before we leave you here, we'd like to remind you to always make sure your client is clear of serious back problems and is not contraindicated for spinal movement and manual therapy before attempting this or any technique for the QL.
Thanks for taking a look at this short video. While you're here, take a look at our upcoming workshop schedule so that we can see you in person for more great integrative bodywork for the manual therapist.